Surgical wound care. Okay. When it comes to surgical wound care, there's 3 intentions. Primary, secondary, and tertiary. Okay, primary being a surgical incision, then it's sutured up and it heals. So primary leaves the least amount of scarring and it's surgically done. So it's an incision, so it's a straight line, it's not a laceration, it's not anything jagged, it's nothing too major. It's good. This is the one that we always want to have when it comes to wound healing. And intention, we always want primary. When it comes to secondary, this gets closed and then we open it because there's infection. And then, once the granulation tissues occurred, we reclose it. This one here, it's infected, but we leave it open to heal. The nurse instructs a patient who has a drain in a surgical wound that his wound will heal by primary intention, secondary intention, tertiary intention, deliberary intention. Tertiary. Good job. When wounds are kept open by a drain, they heal by tertiary intention. Okay? So, if there's a drain, it's tertiary always. Okay. Then there are 3 different descriptive words we use for drainage. That is so drainage. We have serous, which just means it's only bloody. Serous sanguinis, which means it's blood mixed with serum, and then sanguinis, which just means it's only serous. No, wait, I'm sorry. Sanguinis means it's only bloody, and serous means it's only serous. You guys, I'm completely out of it. I'm so sorry. So, you guys, I'll write this. And you, and all of my Spanish-speaking individuals, what is blood?
Sangre.
So why would you even let me write that?
Why?
Because look it. Sanguinis, meaning sangre, meaning bloody. Relearn Latin and medical terminology is hand in hand. So if you speak Spanish, think the Spanish word because for the most part that's what it means. Okay? Okay.
But the bottom one is blood.
Yeah, the middle one is blood and serum, but the bottom one is just blood and the top one is just serum. So, this one is like a yellowish color, This one is a yellowish red, and this is just bright red. The day following surgery, the nurse notes bloody drainage on the dressing. The nurse will record this drainage as sanguinous, exactly. And what does purulent mean? Or purulent? Just spelled like this. This means pus.
Yeah.
It's infected. Okay. So, since we're talking about surgery, there's a way, especially when it comes to abdominal surgeries, that we have to breathe and like support our incision, because there's two things that could happen in status pose surgery. Status pose is always ST. There is evisceration and dehiscence. Dehiscence is a strain on a suture line. Meaning if this is my suture and I cough too hard, my wound is going to open up. So this right here is dehiscence, when it opens, because we strained it. Now, evisceration, if this is my abdomen, and all of a sudden, you see all this? These are my bowels, called my small intestine, or my large intestine. Evisceration means disembowelment. So evisceration means my intestines come outside of my body. And that's what happens when we stress an abdominal muscle. So, this is an emergency situation. We will cover or pick up the intestines, put them back in the body, then cover with normal saline soap gauze. We put our hand on there, we get on top of the bed with them, and we all go into the operating room immediately. We don't remove our hand because the bowels will come back out and we need to keep them inside. Why? Because there's still peristalsis that's going on. So if we don't get their intestines back in them, all the food will get blocked, and then now there's bowel obstruction, which is an even worse thing. So, in order to prevent both of these from happening, we splint the abdominal incision with a pillow when we cough, or when we do our turn, cough, deep breathing exercises, which prevent what? Turn, cough, deep breathing prevents pooling in the lungs, which equals atelectasis, which is a collapsed lung. To assist the post-operative patient to cough, the nurse supports the patient's back, offers an anti-tussive, splits the abdomen with a pillow, leans patient against the overbed table.
The pillow?
To assist the post-operative patient to cough, the nurse splints the abdomen with the pillow. Why are we doing that? To prevent what?
From
Dehiscence. And if dehiscence occurs, what's the next problem that's going to occur? Evisceration. when it comes to occlusive dressing, what does that mean?
That's not the one where you clean it, and then put that, I don't know,
It's like a transparent type dressing?
yeah,
And what does it do?
it, observes,
It protects from the pathogens, but it lets air in?
yeah.
That's what it does. Okay. Occlusive dressing keeps the incision moist and increases the epithelial tissue growth, but it keeps out all the bad pathogens, but it still lets the air in because our skin needs air to grow and heal, all right? The nurse explained that the advantage of occlusive dressing is that it keeps the incision moist. Okay? You want me to write it down? Okay. Say we have a wound, and the wound's been healing, and now the drainage is dry, and we put a piece of normal gauze to this wound. Well, you know that normal gauze is going to stick, especially if it doesn't have that Teflon, that shiny plastic. What can you use to get the gauze off? Because if you rip it, you're going to be bleeding again, so we can't rip it off. So what do we use to get it off?
Water,
Normal saline. When a dressing adheres to the wound, the nurse may moisten the dressing with sterile water or normal saline to loosen it. When the nurse discovers that the gauze dressing has adhered to a wound, the nurse should call the RN, gently remove the gauze with sterile forceps, cover with occlusive dressing, moisten the dressing with sterile water. Moisten the dressing with sterile water.